Okay, let's dive right into this explainer. Today, we're tracing the incredible, honestly unlikely journey of a humble plant genus. We're talking about the evolution of Artemisia, from a toxic remedy to a modern miracle. This botanical family literally went from being a harsh, historical dewormer to the absolute cornerstone of global disease treatment. And as you'll see, it might just be the master key to some major medical breakthroughs in the future.
Now, what's really fascinating here is the accepted medical baseline over a century ago. Imagine going to the doctor in 1911, taking your prescribed medicine for roundworms, and then suddenly you're seeing in bright yellow and your urine turns a startling purple or red. That quote is straight out of the 1911 Encyclopedia Britannica, describing the very real and honestly terrifying side effects of santonin, which was an early drug derived from Artemisia.
So, part one, a toxic historical remedy. We begin our story over a century ago when this plant's medical applications were undeniably effective, but notoriously harsh on the human body. To really appreciate how far the science has come, we've got to understand where it started.
To understand this evolution, we first need to define what Artemisia actually is. Basically, it's a highly diverse genus of plants. This includes species like Artemisia maritima, which gave us that early santonin drug, and Artemisia annua, which is going to be the main focus of our deep dive today. The thing that makes this specific plant family so special is its ridiculously rich and complex phytochemical profile. It is just packed to the brim with highly active chemical compounds.
The crucial point here is that early 20th century medicine clearly recognized the plant's raw power, but they were struggling mightily to isolate its properties safely. When given in large doses, the effects went way beyond just yellow vision and purple urine. Patients could experience severe aphasia, intense muscular tremors, and in the absolute worst cases, total blindness. It was essentially a potent but super dangerous biological weapon.
That brings us to part two, the malaria miracle. This is where modern science steps in and transforms a dangerous dewormer into one of the greatest life-saving treatments in human history.
Talk about a rags to riches story. 2015, that was the year the Nobel Prize in Medicine was awarded for the discovery and isolation of artemisinin. Now, the breakthrough actually happened decades earlier, back in 1972, when scientists finally managed to extract the precise, highly beneficial compound from Artemisia annua without bringing along all that toxic baggage from the past. By extracting just the right compounds, researchers created what we now call ACTs, or artemisinin-based combination therapies. Today, these therapies are the absolute cornerstone of global malaria treatment, especially against the deadly Plasmodium falciparum parasite. It's the recommended first-line defense worldwide, and honestly, it's responsible for saving millions upon millions of lives.
But the story doesn't end there. Part three, the long-lasting shield. Recently, researchers working in Africa noticed something strange and potentially revolutionary happening with patients who were drinking traditional infusions of the whole plant, rather than just taking the isolated pharmaceutical extracts.
Just look at this number. In Uganda, clinical studies using an Artemisia beverage called Arteval resulted in a massive 80% drop in hospital visits for fever-related causes compared to control subjects. 80%. Think about the scale of that for a second. Patients drinking this herbal blend were simply not getting sick with malaria anywhere near the expected rates.
And it gets even more astonishing. Dr. Patrick Ogwong in Uganda and Dr. Jerome Munyangi in the DRC observed that patients who drank the tea actually developed a prophylaxis, a kind of shield, and this protection lasted for months or even years after they stopped drinking it. Hundreds of schoolchildren and patients in Goma remained entirely malaria-free long after just a simple 7-day Artemisia infusion treatment.
Let's put this side by side, because this is a massive paradigm shift. A large trial in Liberia showed a 40 to 61% malaria reinfection rate just 42 days after taking standard commercial ACT pills. But for those drinking the natural Artemisia infusions, near zero reinfection rates lasting for months, sometimes years. The natural infusion was providing a long-term immunity that the isolated pills simply didn't trigger. Now, I want to neutrally report the data here, but this is a profound finding that completely challenges conventional expectations. In a clinical trial in Goma, researchers documented that Artemisia infusions successfully treated and saved the lives of 18 patients where the standard ACT pills had completely failed to cure them. These trials strongly suggest that the whole plant infusions contain a complex synergy of compounds working together to somehow overcome standard drug resistance. So, how is this even possible? Well, scientists theorize this works like a highly localized, skin level security system. Step 1, the mosquito bites. Step 2, specific Ig antibodies, which are heavily induced by the Artemisia plant, react locally right there in the skin. The very moment the mosquito's saliva enters the body, step 3 kicks in. These antibodies trigger a localized response that completely blocks the parasite's movement. It stops the invasion cold before it even really begins.
And the data firmly backs this up. Normally, in a standard population, IgE antibody levels hover around 300 nanograms per milliliter. But in malaria-endemic areas, people naturally produce vastly higher levels, often over 2,000 nanograms. What's happening is that Artemisia infusions appear to artificially stimulate and maintain those exact same high levels of specific antibodies, granting that incredible, long-lasting shield to the patient. All right, moving on to part 4, a new anti-cancer weapon. This brings us to the absolute cutting-edge frontier of Artemisia research, shifting from infectious parasites straight into aggressive oncology. Because, incredibly, this plant's capabilities do not stop at malaria. To understand how it fights cancer, we have to talk about ferroptosis. This is a unique type of programmed cell death driven by iron dependency. Cancer cells usually hoard abnormally high levels of iron to fuel their rapid growth. Well, Artemisia compounds exploit that exact weakness. They essentially use a cancer cell's own iron against it, triggering a volatile reaction that kills the tumor cell while leaving the surrounding healthy cells largely unharmed. It's brilliant. And the applications here are incredibly diverse. Preclinical studies are showing that Artemisia compounds can arrest tumor progression across a whole range of models. We're talking breast cancer, lung cancer, colon cancer, leukemia, and prostate cancer. Those phytochemicals we mentioned way back at the start are showing profound abilities to stop these specific, dangerous tumor lines in their tracks. But here's what has researchers so hyped right now. These derivatives don't just fight cancer. They specifically target cancers that have learned to resist our standard treatments. Compounds like artesunate and dihydroartemisinin are proving highly effective at overcoming multi-drug resistance in solid tumors. For oncologists dealing with stubborn chemotherapy-resistant diseases, this is a real game-changer. Finally, part 5, the future of Artemisia. So, where does this botanical journey take us next in the broad landscape of global medicine?
Well, beyond malaria and cancer, the plant's essential oils and compounds are showing potent activity across a staggering array of fields. Research is exploring its antiviral properties against emerging pathogens like SARS-CoV-2 and hepatitis B. It's showing antimicrobial power against multi-drug-resistant bacteria, strong antifungal properties, and get this, it even works as a highly effective agricultural biopesticide to manage crop pests safely. It's really the whole shebang. But to truly harness all these benefits without risking further drug resistance, the medical community has to act carefully. The urgent next step is conducting well-designed, large-scale Phase 3 clinical trials. We have the preclinical data, and we have those incredible field observations. Now, we need the rigorous validation to officially integrate these whole plant therapies into global, evidence-based medicine. Think about it. When a single plant can evolve from giving you purple urine in 1911 to winning a Nobel Prize for malaria treatment, and now potentially fighting chemotherapy-resistant cancer, it truly makes you wonder, what other incredible medical miracles are just hiding in plain sight in our gardens, waiting for us to finally understand them? Thank you so much for joining me for this explainer on the remarkable science of Artemisia.